This is Dr. Wes Howard at the Senior Center, and we're talking about Alzheimer's dementia. And this is in a series of lectures that I gave. I have a picture here of me because if you listen to this recording, you're not going to see me except that there's a picture of me with my mother. My mother had Alzheimer's, and I am dedicating this to her. But these are a series of lectures about things that people want to know about. And the thing I'm interested in is the scientific evidence. Everybody has opinions about things, and we live in a culture where there's lots of conflicting ideas, even diet wars and things like that. But I'm interested in what is the science. A lot of this is based on Michael Greger's work at nutritionfacts.org, which you can get on a sheet there. So we're going to focus on Alzheimer's dementia. What is it? What is Alzheimer's dementia? Alzheimer's dementia is a neurologic disease. It's progressive, it's degenerative, it's incurable. What does that mean? That means that when brain cells die, the final pathway of Alzheimer's, once those are dead, they're not going to come back. And so for the most part, once it becomes evident that you have Alzheimer's, you cannot turn it around and make your brain normal again. It causes deterioration in brain, nerve cell, and ultimately death. That's both death of your brain cells, but also it often leads to death. The two pathologic manifestations when they do autopsies are amyloid plaque and neurofibrillary tangles. The tangles and the plaques are the things they find in the brain. Now, you can't absolutely be sure 100% that somebody has Alzheimer's until you do an autopsy, but it's clear enough clinically, a neurologist can say this is really Alzheimer's. And these are what they look like. These tangles here in the neuron and then the amyloid plaque, when they see those two things. And so there's been all kinds of theories about what causes these, how they happen, what can we do to prevent this. What is Alzheimer's clinically? It is signs and symptoms of dementia. Your brain starts not working as well. Seems like one of the first things to go is names. Of course, some people have problems with names their whole life, but finding yourself struggling to remember recent events or dates, find it hard to follow conversations or TV shows, and some of these progressively get deeper and deeper. Find yourself forgetting the names of friends or everyday objects, repeating words and forgetting what you were saying, finding difficulty thinking and responding, and then you start getting emotional things, anxious, depressed, angry, behavioral changes, because the brain obviously affects behavior. Feel a decline in ability to talk, read, or write, and then you feel confused, disoriented. And, all of you probably know somebody with Alzheimer's, and the saddest thing is you get to the point where their body is there, but it's like their mind and the person they are is gone too. Now, one of the common struggles is the question, are my memory problems, are they normal, or am I beginning to get dementia? So you see early signs of dementia on the left and normal aging on the right. And, like names, where am I? Am I normal, or am I early signs of dementia? What I notice is there are days when my memory is not as good as other days. There's days when it's bright and clear. Sometimes I can remember that person's name, sometimes I can't. So there's a variability, but subjectively, sometimes it's hard to say. Jackie and I will go back on, today you remembered his name, yesterday I remembered it. So who's normal, who's not normal? Obviously, it helps to get a professional who can do neuropsych testing or anything like that. But what you notice is these things progressively get deeper, forgetting names, forgetting things, repeating phrases or stories in the same conversation, unpredictable mood changes, decreased interest in activities or difficulties, and then you get kind of a fading away of the person's mental abilities and personality until they become less and less. Now, if a person begins to feel like their brain is working normally, so something wrong, one of the things I think Western medicine is best in is diagnosis. Okay. We're so good at diagnosis, sometimes we overdiagnose, but this is a place where if a person thinks their brain is, over the last 2-3 years, I need somebody to check me out. I had a man earlier when I gave this lecture, who said for 3 or 4 years he used to have a photographic memory. Now he lives by himself. He can't remember certain things. And he says, I'm talking to my doctor. He just says it's old age. But I want to know, what is it? So here's what I recommend. Alzheimer's fits under a bigger umbrella called dementia. Dementia simply means your brain's not working. But if a person starts saying, something's not working well about my brain, then they need to be evaluated for dementia, looking for treatable causes of dementia. Not Alzheimer's, but something that actually can be found and reversed. And here's a list of them. It's kind of busy, but these are things. A number of years ago, many years ago, I actually was diagnosed with B12 deficiency, pernicious anemia. One of the manifestations is dementia. Okay, I wasn't too demented, but so that's a treatable cause. What you're trying to find: thyroid problems, both low and high thyroid. Obviously, alcohol abuse. The person knows they're doing something, and there's all kinds of other things that can cause what looks like Alzheimer's, but guess what? Good news, it's treatable. It can be reversed. So that's the reason to mention this. But under that umbrella of dementia is Alzheimer's, or the dementia syndromes, of which Alzheimer's is the main one. There are other ones. Parkinson's has some dementia with it, some more than others. Vascular dementia, you get multi-infarct, little tiny strokes all over your brain. And then Lewy body, again, is a unique form. But Alzheimer's is 75% of the people with dementia is Alzheimer's. So when does Alzheimer's start? Here's a graph that kind of shows you from being normal. Over the years, notice the 3 different lines with different trajectories. That gradual decline of your brain, quite as sharp as it used to be. And so you have preclinical when, it's not that bad, but it's not really terribly abnormal. Then the stage just before dementia is cognitive impairment, moderate cognitive impairment, I think it's called, MCI. And this is where you're kind of in the middle. And then distinctly, you start clearly going downhill, mild, moderate, severe, and severe dementia. So at what point does Alzheimer's actually start? Is this Alzheimer's here, but this in here? And what we found out is bad news. The anatomic or autopsy evidence is that the neurofibrillary tangles are seen as early as age 20. So at age 20, we have the earliest evidence that something has started. Notice that this is the mildest form, and oftentimes it's, how many 20-year-olds think their brain is going, their memory is going. But what you see is this more serious stuff really starts in 65 is the time at which is much more frequent to get Alzheimer's diagnosed, clearly clinical, present. But here's the point, and I want to make it because we're talking about lifestyle diseases. There are some diseases that are under the radar. They are beginning the early stages of it, and if you want to be totally normal, lifestyle has to start back at the beginning. Okay, so that's the bad news. The good news, it doesn't show up until later on. But the problem is, once you become clinically symptomatic, they say that a lot of your brain cells are gone. If they're gone, they're not coming back. So you want to do everything you can early on. Now, here's an interesting little thing, a peanut butter sniff test. I thought this is really kind of interesting and delightful. That you can actually, and this is supposed to be 100% sensitive and 92% specific for Alzheimer's disease. I've actually had a woman that I did this on. But here, classic Alzheimer's disease starts on the left side of your nose before it starts on the right. And the first evidence you have is your smelling. Your smell changes. You may not notice this, and what you can do is you can take peanut butter and a centimeter ruler and close off the left side of your nose and start sniffing, then can you smell the peanut butter? At 17 centimeters, you're normal. But then on the left, if you can't smell it till 5 centimeters, that's in the study that was done. That is the kind of the standards at which they diagnosed Alzheimer's or normal. Okay. So if you have 17 centimeters on both sides, if you have 5 centimeters on both sides, maybe you're already to the right side of your brain. But anyway, that's an interesting little test. If you're interested in looking it up, this is from Michael Graves, but a brief olfactory test for Alzheimer's disease. Now, the bad news is that Alzheimer's is becoming epidemic in the United States. From almost non-existent in 1900 to 150 years later, no, 2050, okay, yeah, 150 years later, is that right? Is my brain working? Okay, all of a sudden we've got a huge increase. Notice 65 to 74, it's not huge, but as you get older, it gets much more significant to where it's really kind of epidemic. If you look around the world, the darker red it is, the more common is Alzheimer's disease. The more yellow it is, the less. And what is anything about this distribution that makes you think of something about lifestyle? These are affluent countries. Okay. I will show you later on, India has the lowest incidence of Alzheimer's in the world. And I'll also point out Nigeria. There's something about Nigeria that I'll tell you about later on. Now, here's the sad thing about Alzheimer's. I had a grandmother. I had a great-grandfather who had Alzheimer's and lived with my aunt. And she called it the long goodbye, because slowly they're drifting away, where their body is there and they're not there themselves. This is myself and my mother, who ended up in Bridgewater Retirement Home and died with Alzheimer's, and she didn't even recognize me towards the end. It was really sad. So this is not just a disease in which you lose an arm or an organ or something like that. You lose your self. Strange. Okay. The bad news and the good news is Alzheimer's disease is incurable, but preventable. What I mean by incurable is not that it can never be made any better, but there are irreversible things that happen. And I'll compare it with heart disease, which has some similarities and differences. But and lots of money has been poured into this. As many as 100 papers a day are published on Alzheimer's, and yet we have neither a cure nor an effective treatment for the disease. That's not very good. Okay. Alzheimer's is reaching a stage of crisis, emotionally, economically, and even scientifically. So if it's incurable but preventable, what about genes? Now we are a culture that obsesses about genetics. Genes do play a part in Alzheimer's. How about genes? If you come from a family where you know you have people with Alzheimer's, let's say both your parents had Alzheimer's. Okay. You live in an Alzheimer's family, you're going to get it. Nothing you can do. Well, what is the genetics of Alzheimer's? The main gene that we know that contributes to Alzheimer's is APOE4. It's a gene, and these are the genetics of it. If you have one parent with that gene and they give it to you, it's one of these map out your DNA, MEAT 23, you can send it off. You could probably get this one as part of it. If you have one parent, then compared to the general population, you're 4 times more likely to get Alzheimer's. If you have 2 parents, they both give you have 2 genes, you have 10 times the incidence. Okay. In Nigeria has the world's highest prevalence of this gene. Okay. So does this gene determine your future? Is it genes? What's interesting is Nigeria has one of the lower incidences of Alzheimer's in the world. They have the highest genetic predisposition, but one of the lowest, because epigenetics modifies the expression of this gene. And it's due to their lifestyle, which is low animal fat. This gene works through cholesterol. Lipoprotein is one of the carrier molecules for cholesterol. This gene functions through cholesterol, not by itself. So if you eat a diet low in cholesterol, you don't get dementia. So in Nigeria, where the frequency of APOL is high, but there's low cholesterol levels, it seems to be rare. However, African Americans, now, here's the thing. Because they have a genetic predisposition, if they change cultures and go to a culture that has lifestyle that encourages Alzheimer's, they will get it at a much higher rate. So it can be expressed if you feed it what it wants to be expressed. So the association between the APO genotype and cholesterol concentration may be the result of Western lifestyle, since no association was found in an African Bushman population with low plasma cholesterol. So here's the issue. Good news is if you don't feed this gene the cholesterol it wants, you cut down from 10%, you even cut down below 4%, 4 times to 2 times, because this 4 times is based on a culture that feeds this gene what it wants to be expressed. So if you do lifestyle epigenetics and cut down on cholesterol intake, you're going to have less expression than that. Okay, what about treatment? Here's something on treatment. And I show this because it gives you an idea what the natural course in this study of Alzheimer's is, getting worse, worse, worse. They studied saffron, which is a spice from Iran, expensive spice. They use it in rice, use a lot of things. But if you take a regular dose of saffron and you compare it to Aricept, one of the standard Alzheimer's drugs, does the same thing. And what's interesting is Aricept has lots of side effects. Saffron has almost none, but good ones. So this plant is as good as the expensive medicine. Now, how many of you have heard of coconut oil for Alzheimer's? Because drugs don't work that well, coconut oil has almost a mythic following because of this doctor, Mary Newport, and her husband, Steve, who had Alzheimer's. She was fed in coconut oil, and it cured him. So she's become famous. You can Google this and find all kinds of things. This is obviously an anecdotal thing. One of the studies shows, now, the ketogenic oil was obviously used in, the coconut oil was used as a ketogenic agent in this study, and it showed some slight improvement, but then the placebo, they came about to the same thing. So it wasn't felt that it was amazingly helpful in terms of Alzheimer's disease. And I'll just leave that to you. If you have an anecdotal incident and it seems to help, you're not going to say, oh, that didn't happen, but what you're going to do is say, to generalize it to a population, you need some science to prove that it works for a broad range of people. So if it's incurable but preventable, what do you do to prevent Alzheimer's disease? How can you prevent it? Well, what I said before is it's a lifestyle disease. And these are, the understanding of lifestyle medicine, these are all lifestyle diseases. Type 2 diabetes is a lifestyle disease. Hypertension. Now let me just tell you what I mean by a lifestyle disease. Hypertension in the United States is understood to be part of getting old. When you get old, you get hypertension. The majority of people in the United States have hypertension. If you go to the middle of Africa, the middle of China, the middle of India, and you take people from there, then you ask, do they naturally get hypertension as they get older? Well, a lot of it depends on their lifestyle, but if they're plant-based, eat mostly plants, they don't get hypertension in their later life. And then you take one of those people from India or Africa or China, you bring them to the United States, change them to the other culture, then they start getting hypertension. That's what a lifestyle disease is. So type 2 diabetes is lifestyle disease, hypertension, obesity, depression has a big component of lifestyle. Physical inactivity, that is lifestyle. Smoking, that is lifestyle. Cognitive inactivity. Now, this is a graph about reducing the numbers of Alzheimer's disease cases. If you take diabetes and you improve it or reduce it 10%, you get less Alzheimer's. If you reduce it 25%, you get even less. And if you take all these things, you work on every one of them, you combine them, that's pretty significant reduction. Probably 60% reduction of Alzheimer's disease. So if you take a person, you perfectly design their lifestyle, all optimal, then it's much less likely that you get Alzheimer's. But then the question is, what's the ultimate lifestyle? What's the most important thing in lifestyle? If you look at this, risk factors for death and disability, it used to be tobacco smoking 50 years ago. It's now diet is number one. The most powerful thing in your lifestyle is what you eat. What you eat is the most determinative. Not that these things, not that high blood pressure, activity, sitting in a desk all day, high cholesterol, alcohol abuse, other things like that. Those are risk factors, but diet has now come to be the number one thing. And what we find is we look around the world, the countries in which there's a higher fat intake, both saturated and non-saturated, there's a higher incidence of Alzheimer's disease. So that is a lifestyle thing. This has to be teased out to what the specifics are. And then you take a person or a group of people that have Alzheimer's and you say, once they have it, clinically have it, they're symptomatic, what can you do if you alter their lifestyle, and specifically if you put them on a Mediterranean diet? In traditional medicine, Mediterranean diet is now the gold standard of the best way to treat a lot of things. There actually are better diets for a number of things, but Mediterranean diet, part of the problem with Mediterranean diet is, what is the Mediterranean diet? Is it pouring olive oil on everything you eat? Some people, I'm going to eat the same thing I ate yesterday, but I'm going to pour olive oil on it. Today it's Mediterranean diet. Okay. But here's the point. These are three groups of people. They all ate a Mediterranean diet. Some ate it lightly, middle, high capacity Mediterranean diet. And notice that it reduced their mortality. It slowed their mortality down, but it didn't stop it. That's what we mean by incurable. You can improve the outcome to some degree. You can't stop it and reverse it. So it is helpful to change certain things in your lifestyle, but it's not going to completely alter it. Now, the two theories of etiology, I mentioned this not to get it too complex, but the theories have been battled over as far as what contributes more and, all the different factors. We live in a culture where people say, well, this year we hear about this, and this year we hear about that, and, what's causing this, and you shouldn't do that. But the two different theories are what's called an amyloid cascade hypothesis, that the amyloid plaque is the thing, and what causes that? Inflammation, this factor, that factor. And the other one has been around for a long time, vascular hypothesis. It's actually decreased blood flow. This first woman in 1901 that was examined by Dr. Alzheimer, a German physician, whose name is obviously given to the disease, noticed when he did an autopsy on her that she had a lot of hardening of the arteries around her brain. And this was just a observation that nobody thought this had anything to do with the little plaques and tangles in the brain. But what's happened is these two hypotheses have now been combined into one that contribute to each other. So decreased blood flow because of plaque in the arteries, then hypoperfusion, and the things it does that cause the increased plaque over here, and those become a vicious cycle as far as the etiology. And what they're doing is going down to a final common pathway from two theories to one kind of combined theory. And atherosclerosis and cholesterol are the two kind of parts to this. Atherosclerosis is one of the keys to Alzheimer's disease, and this is the predominant consensus scientifically. And atherosclerosis is an omnipresent pathology that involves virtually the entire human organism. One of the most poignant examples of this systemic nature of atherosclerosis is the link between coronary disease. If you have coronary disease, you have a much higher incidence of dementia, degenerative brain disease and dementia. Now, the difference between coronary disease and dementia is coronary arteries can be only the arteries and nothing else. A person can have a heart attack if they get to them fast enough and get the flow back. You can keep the muscle from dying. But with Alzheimer's, it may be the atherosclerosis that's causing the problem, but when you have neurons that are lost, then that's an irreversible process. Cholesterol works both directly and through atherosclerosis. So notice the APO4 gene works through cholesterol, but if you can actually find places in the brain where cholesterol crystals are where these fibers begin to come together. And notice that the higher your cholesterol, the more likely you're going to have Alzheimer's. Individuals with higher cholesterol levels at midlife have a higher risk of developing Alzheimer's. And then cholesterol is a key to Alzheimer's. It counts for the majority of cases, both directly on the brain and indirectly through atherosclerosis. So here's one of my recommendations. Bad news. Okay. But good news, if you know that you have atherosclerosis, and early on people that have it don't know they have it, so you can actually find out a fairly simple way. Get your carotid artery ultrasounded. Jackie had her done a number of years ago and had some plaque on it, and after we changed our lifestyle, it went away in 2 years. So this is something easy to do. Any doctor can order it. You just get an ultrasound of your carotid, and they can look through there and they can tell, do you have thickening of the intima, the lining of the artery, and they can tell what's normal and what's abnormal. So they can measure it. It's non-invasive, easy to do. And if you have atherosclerosis, that's bad news, but here's the good news hidden in the bad news. You can do something about that. You can actually reverse atherosclerosis. You can take atherosclerosis, which is plaque building up in the arteries, and you can actually, we know now, you can actually completely reverse that. You can clean out your arteries. And I'll show you the next slide what it does. But here's what they found out. If you take people at the beginning of Alzheimer's disease and you grade them as to how bad is their atherosclerosis, more minor, more serious, and very serious, the clinical outcome will be directly related to how much of that they have. The worse the perfusion of their brain, the faster their Alzheimer's is going to progress. So the good news is if you can open up some of your atherosclerosis and open up the blood flow to your brain, the outcome will be much better. If you were just found to have Alzheimer's, you have some early minor symptoms and you're aggressive about changing that, you have a much better possibility of having a better outcome. This is a quote from Michael Greger, and it's about a plant-based diet. If all that a healthy plant-based diet could do is reverse heart disease, and I'm going to explain this in a minute. This is kind of right in the middle. Reverse heart disease, the #1 killer of men and women in the United States. Shouldn't that be the default diet until proven otherwise? Let me go back. One of the talks I gave was on ischemic heart disease, which is what causes heart attacks. And we now know, through the work of Dean Ornish and Caldwell Esselstyn, that you can take people that have had a heart attack and otherwise have a totally normal heart, and if you put them on a strict plant-based diet, it's now been proven since 1990, Dean Ornish did it, it was printed in the Lancet, you can show that you can actually open up the arteries with a plant-based diet. You can reverse it. So unlike Alzheimer's, you can reverse a person back to practically a normal heart. And that's the best you can do for Alzheimer's. That's the thing we should do. But if that's all it can do, it ought to be the default even for Alzheimer's. If somebody wants to get serious, that's what they should do. And the general saying is, whatever is good for your heart is good for your brain. So if you do this lifestyle change in order to reverse atherosclerosis, and it improves your heart, it'll also improve your brain. It'll do the best thing you can do to improve your brain. Now, the key to change is not your brain, but your heart, right? I think we should find a good, healthy diet and really stick to it this time. I agree, as long as the diet consists of exclusively of pizza and cheesecake. I'm with you 100%. Now, even the heart is not the way to change the life. It's the stomach, right? At least men's hearts are reached through their stomach. Okay. Is that true? I hear a true there. Okay. I won't agree with that. But anyway, another thing that contributes, another thing that's bad on your brain is what's called advanced glycosylation end products. Advanced glycosylation end products are, you see an example here, but I'm going to tell you exactly. It's a result of protein and sugar in a hot environment, like on the grill. So what happens, it's kind of the browning of the meat and all that stuff, and it creates something called advanced glycosylation end products. They're toxic to your brain. They're not good for your brain, and they make Alzheimer's a lot worse. So if you have somebody that loves their bacon, loves their barbecue, chicken, broiled hot dog, those are the three main ones, and they eat a lot of that, they're doing something bad for their brain. So one of the things, another thing that processed meat is also a carcinogen, causing more colorectal cancer. So I personally don't think anybody should eat this. Now, the thing is, if somebody says, I want to eat it once a year or a few times a month or whatever, that's their decision. Believe me, you can do whatever you want. But this is not something good for your brain. So all these things, and you can look this up and try to figure out. Somebody asked me earlier, what kind of cooking creates less of this than another? If you want to eat chicken, let's see, let's go for, okay, baked chicken would be a whole lot better than barbecued chicken. Okay. And then broiled chicken is not as good as baked chicken. That's interesting. Barbecued chicken? Wait a minute. It's twice on there. I thought it was cheating. Anyway, we found a mistake. Okay, now, here's what I said before. India has the lowest incidence of Alzheimer's in the world. And Jackie and I just went to the Indian store and bought some turmeric, which I'm going to come to in a minute. Why does India have the lowest? Well, one is they have a lifestyle that tends to be not producing of Alzheimer's, but there is a theory that it's due to the turmeric. And the curry, we just went to the Indian store and the guy there said, you know, I've been eating turmeric since I was born. I use a quarter of a teaspoon every day. And their curry, it's just, you know, they use it in all this stuff. So there is now research going on about, is this the key? Michael Greger lists 3 anecdotal studies of people that were diagnosed with Alzheimer's, and then they started to give them a certain dose of turmeric, and guess what? They improved. Those are 3 anecdotal things. Now, what they have to do is do a lot more studies and figure out, is this actually a repeatable, you know, verifiable thing? I had an interesting little experience because I have been kind of pursuing this for 6 years. In the last 3 or 4 months, I said, let me push it to the next level. So I've started taking flaxseed, ground flaxseed, and I started taking turmeric. I thought, which is the best form of turmeric? So I was researching, and I came up with this one that, now turmeric is absorbed a lot better if you put it with black pepper. So this has turmeric with black pepper. I thought, oh, this is great, capsules. And so then I thought, Michael Greger, he's kind of the expert on this stuff. Let me read what he wrote. If you know this book, How Not to Die, this is from his website. And in the second half of this book, he basically takes what he does every day. I eat beans 3 times a day. I eat hibiscus tea. I drink it all the time. You know, he researches and he does the thing that's healthiest for him. And under spices, turmeric is #1. That's his favorite spice. And so I say, okay, how does he know which kind? Well, you know what he does? He does 2 things. He has the root, the turmeric root. It looks like ginger, but it's really deep orange inside. This is a turmeric root. I get this from Whole Foods. And I'll bite off a little bit one day. You know, every few days when I think of it, it turns your tongue orange. But that's the real thing. That's unprocessed, unrefined. And then curry powder. We went to the Indian store and got turmeric powder. They say it's totally nothing but turmeric. And this is like $5 for this whole thing. It'll probably last a year. And then curry powder of different kinds. So Michael Greger's thesis is plants in their natural state. Now, there's some plants that are a little hard to get in their natural state, but as little as you can process them or refine them, and you don't want engineered stuff. So he is into using, he will take this with a little grater and put it in his smoothie, or he'll put it in something he's cooking, both raw and cooked. And he'll take a little powder, maybe put that in a smoothie, or put that in what he's cooking. So that's the way he does it. I'll have to reevaluate my pills. They're easier to use, but anyway. Okay, so turmeric root or curry powder, and then this one that I found in a number of different sources. Costco has it. It would be nice if this was as good. But here's what you have to do to prove that something, if you take turmeric in its natural state, and you prove that it does all these things for people, and then you take it in a pill form, very often in the past what they found is something is lost in the process. Plants have so many things in them that there are many things in them we don't even know what they are. We think an orange has vitamin C. Well, okay. An orange also has bioflavonoids. And when we used to make vitamin C, we thought that was great, but the bioflavonoids add to the vitamin C. So the whole is greater than the sum of its parts. Mm-hmm. And whenever we process or refine, it's not intrinsically evil, but it oftentimes will take some of the active things that we need, and we don't know that until we see the results. Okay, another thing that's very beneficial is bright colored fruits and vegetables. The bright colors are antioxidants. Both the colors and the flavors and the smells often come from very potent antioxidants. Your brain is only 2% of the weight of your body, but it uses up to 50% of the energy that your body uses. So there's a lot of chemical reactions in your brain and a lot of opportunities for inflammation and free radicals. And the antioxidants in these bright colored blueberries and strawberries and green leafy vegetables are very beneficial to keep your brain in good shape. So, and they have shown that if a person, what Jackie and I want to do is eat as many blueberries and strawberries and greens as we can to keep our brains in good shape. It does help a little bit once you get Alzheimer's, but again, you want to do it before the fact. Another thing that makes a big difference is exercise helps with mild cognitive impairment, but also can help somewhat. Of course, as you get worse, it's harder and harder to exercise, but exercise is another lifestyle manifestation. One of the talks I've given that's my favorite one is the blue zones. And the main idea I want to give you here, the blue zones, for those of you who don't know, are the National Geographic effort to find the longest living groups of people in the world. Ikaria, Greece, Sardinia, Italy, Okinawa, Japan, Nicoya Peninsula, Costa Rica, and Loma Linda, California. These are groups, cultures of people that regularly the people live to over 100 and they live a healthy old age. And what they did is they studied this. If you don't know anything about the blue zones, here's the point. Health comes from a culture, not from one thing you do. You don't say, turmeric's going to cure me and I'm going to go home and take enough turmeric to be a normal person. Well, that'll help, but health comes from a culture. It comes from a whole environment. It comes from relationships. It comes from how you eat. It comes from how you sleep. It comes from how you move. So learn the culture of health. Learn the culture of a good, healthy brain. One of the things that we made the observation about these cultures is many of them are very hard to live in. They're not easy cultures. We've become such an easy culture. If we want everything to be easy, that naturally. And what's interesting, in some of the blue zones, the younger kids don't want to live the life the old people live. They want the easy conveniences. So guess what? The life expectancy is going down. The quality of their life is going down. Now, let me just warn you. What I'm saying is there is a fairly clear lifestyle of brain health that I've already given you some of. There are people in our culture, and our culture has many theories of health and many theories of how you're healthy, one of which is fought around the whole thing of diet. And I gave a lecture called The Diet Wars, which is up on YouTube if you want to let me know and I'll show you where it is. And part of the diet wars are actually paid for by vested interests. And this one is paid for mostly by the Egg Board. It is the paradigm of healthy diets. Saturated fat and cholesterol are good for you. Now, I don't want to demean this paradigm except to say that scientifically there's a lot of question about it. Okay. It's very confusing if I say, saturated fat and cholesterol are bad for your brain, and you turn around and say, saturated fat and cholesterol are good for you. So this is about the healthy fats. There's a number of people into the healthy fat movement. And what's happened is vested interests have paid for studies where you may have heard, we used to think cholesterol was bad for your heart, but there's some recent studies that show that it's really not bad for your heart. Well, those are messages that are paid for by groups that make money. So 84, cholesterol is bad. Now butter is back. Eat butter. So it's very confusing, but Michael Greger goes back to the tobacco period when the tobacco was big. And back then, tobacco recognized as their doom was certain that they could simply create doubt. If they created doubt, and people said, these experts, they don't really know what they're talking about. I'm just going to do what I want to do. So doubt leaves people skeptical and saying, it doesn't really matter what I do, which is not true. So if cholesterol and saturated fat are bad for your brain, and now there's a new movement that says, do this. And one of the people that's written about this is David Perlmutter in Grain Brain. Now, in the diet wars, Grain Brain and David Perlmutter say our main problem is sugar and carbohydrates. So what causes your brain to be bad is grain, gluten, and other things like that cause inflammation and cause Alzheimer's. Okay, that's a perfectly legitimate theory. Okay, but on the other side, you have people that are saying it's all fat. It's not sugar, it's fat. Well, actually, it's both. Neither of them are good. Sugar and fat are not good for you. Michael Greger has a video on Alzheimer's disease, Grain Brain or Meathead. I'll let you look that up and watch it. It's very good. But here's historically what people who have studied nutrition over a long period of time have basically said. Historically, we know that dietary cereals and grains are strongly inversely related to Alzheimer's disease. Is that a double negative? No. But it's a little confusing. Grains and cereals are actually beneficial to your brain, not detrimental. Now, if somebody has gluten sensitivity, that is a significant thing. But historically, and the article in Neurology, pass the grain and spare the brain. So these are some of the concerns. And David Perlmutter's anti-Alzheimer's trio is the good fats: avocado, coconut oil, and grass-fed beef. So I would just say it's up to science to prove which of these is true and what are the outcomes. Now, let me summarize this and say Michael Pollan, who's spelled with an A because the next slide is going to be an E, he's the guy that's written all about food and food culture. And I like the way he puts it simply. Eat food, not too much, mostly plants. That more or less is the short answer to the supposedly incredibly complicated and confusing question of what we humans should eat in order to be maximally healthy. So he gives a very simple, but I think for the most part accurate, and here's the even more simplified. Eat food. What he means is don't eat food-like substance. If your grandmother wouldn't recognize it's food, don't eat it. If it is made in a plant, it's probably not good. If it comes from a plant, it's probably good. So eat real food, not artificial, engineered junk food. Don't eat too much. Don't stuff yourself. Don't overeat. And eat mostly plants. The blue zones, the summary of the blue zones is in every one of these diverse cultures, 95% of what they ate was plant-based. And that seemed to be, and here's the argument. You can take the paleo diet, you can take the ketogenic diet, of which probably the Eskimos were the closest to living in that kind of paradigm. They were held up as the model of health by people who really didn't know the extent of their lack of health. But as we've studied them scientifically, they're not healthy people. They're Eskimos that live in the North Pole that eat mostly animal stuff. A couple months a year they have some berries because otherwise there's no plants around. But they are not healthy people. We lived among the Maasai in Kenya, and they are also not healthy either. So a healthy culture live it and love it. The way to change your behavior is not through fear and anxiety. That can work. But the way to change your behavior is through eagerness and hope and expectation. And getting the point where you love the change. When I work with a patient as a lifestyle medicine doctor, my hope is to have them try something, even if they say, oh, this is going to be hard. I'm not sure I want to do this. Okay, try it for 3 weeks. See if you feel better. If you begin to feel better and you get into a positive reinforcement of the more you do, the better you feel, the more healthy you feel, that becomes a positive reinforcement of liking it and loving it. You need to get to the point where you absolutely like the way you live. Every choice you want is a good choice. You don't deny yourself other choices, but you just simply don't want them because they don't give you health. So this is the way to go in the direction of finding a brain-healthy life. And one of the things up here I've put together is a list of things that you can go through and ask yourself. Family history, epigenetic, turn your genes off. Lifestyle, disease, blue zones, hypertension, diabetes, heart disease. Not drugs first, lifestyle medicine first, to see if that will change. I have patients that I've gotten off hypertension medicines, ischemic heart disease. I have a man who has recurrent prostate cancer. He had a radical prostatectomy 5 years ago. His PSA is now going up. I told him, hey, you need to be pretty strict. Get on a totally plant-based diet. His PSA is now going down. And Dean Ornish showed that you can actually reverse early prostate cancer with a plant-based diet. You can also turn cancer pro-genes off and turn on genes that are anti-cancer. Pretty powerful stuff. The conversion I came to 6 years ago is this. Lifestyle is far more powerful than Western medicine. Western medicine is very powerful. We're very impressed with all it can do and all its technology. But here's the way I summarize it. Western medicine has become very technologically savvy, high-tech, very able to do a lot of things, but we oftentimes have forgotten what's down on the ground, what's the common, ordinary way to do things. And we've become so a tendency to look up here and think that's where the solution comes, and the solution actually comes right in front of our nose, the very things we do with our hands and feet and mouth. Those are the most powerful things. And once you see that, what I've seen is some amazing things as far as turning them around. So that's it in terms of Alzheimer's. There's many other things that I haven't talked about, type 3 diabetes of the brain. So I read about that, but didn't think it was that important to bring up. But there's a lot of other things. But this is the main thing. I want to give people an idea of what they can look into, what they can do, how can they make their life better. Let's say you have no evidence of Alzheimer's, but you want to make sure you don't get it. This is the way, and here's what I would say. This is the way not just to try to prevent Alzheimer's, but this is the way to get heart disease better. This is the way to get hypertension. This is the way to get lots of things. Keep yourself from getting diabetes. This is something that helps people a lot in all these different areas. And that's why it's worth going that way. Now, as a practitioner, I know people are going to do what they want to do, and that's fine. People can listen to this and say, you know what? I like the way I live. I like the way I eat. I don't want to change. Even if I have type 2 diabetes, I have friends that say, look, I like my life. I don't want to change anything. Okay, that's fine. You're the head of your life. Do what you want to do. But this is a way that is open for anybody to try and say, I want to see how well I can get. Because as you get older, these things can begin to pile up. And it's never too late to change, but the difference between heart disease and Alzheimer's is heart disease, actually type 2 diabetes. It's amazing what changes can take place in people with type 2 diabetes. Diabetic neuropathy, people have totally numb legs or burning pain all the time. The studies have shown within 4 days, some of those things begin to get better with a plant-based diet. Amazing changes. Some renal insufficiency can be turned around. I mean, some diabetic retinopathy. It's really amazing. So that's my recommendation to you all. Study it. Become an become a student of health, a researcher who's looking for all the ways they can get healthy. That's my recommendation. Go with it with great vigor.